So each episode we visit with representatives, and this time around I was able to visit with Representative Scot Matayoshi of Kaneohe. We're going to go and see a visit with him at the state hospital, where we got a glimpse of the new state-of-the-art facility, isolation and quarantine units that have been set up there to respond to the pandemic, and then have an opportunity to speak with staff and members at the Joint Outreach Center, where they're hoping to have a community outreach court in the future. We learned about the resources at the Joint Outreach Center that they continue to provide and the ones that have changed due to the pandemic. So let's go to Rep. Matayoshi. So Representative Matayoshi, thank you for inviting us to come visit this facility. Why is it so important for your district and your community?
This new facility is made to be much more secure so that we have fewer escapees, we have fewer people exiting the state hospital directly into the community that may be a danger to the community. It's also really important for these forensic patients to have proper treatment. So this new building is structured to properly treat forensic patients, and I'm hoping that the building that they're being moved out of, Goonsburg, can be used for non-forensic patients. So we have increased beds for people who did not commit a crime or not court ordered, so homeless that might be picked up off the street, people living with their families right now who may need that mental health treatment. Now we're going to actually have beds for them to get the proper treatment they need and get them out of the community, off of the streets, somewhere safe. All right, well, I'm here with Ron Heidelberg, the CEO of the Hawaii State Hospital here in beautiful Kaneohe. Ron, could you tell us a little bit about the new building and maybe the purpose and need behind it?
Oh, yeah, sure. The new building patient facility is a 144-bed facility. It has a lot of treatment rooms inside the building. So the first floor is the treatment mall. And so the treatment mall has a courtroom. It also has a chapel. It has a lot of group rooms that we can try to rehabilitate patients with. And so our main focus is to admit patients, rehabilitate them, and get them back into the community safely. Yes.
Why did the state hospital need this new building?
Okay, the state hospital needed this building because we ran out of bed space. And the lower campus, if you see, we use those group rooms that we used to have and classrooms for patient rooms, and so it got really crowded. And what this new facility will do is help us to categorize the different types of patients we have, and then we can really specialize their care that way.
Okay. Can you tell me a little bit about the dynamic between the forensic patients, non-forensic patients, and the problem that's been happening with the state hospital?
Okay, so the way we can categorize them now, we'll be able to separate them out like that and have a high security unit, like an all-male unit, and then we'll have rehab units like that. And so we can really have specialized care for each level of care as they get ready to reintegrate into the community.
Okay, great. And so just to clarify, by forensic patients, we mean court-ordered patients. Can you tell me a little bit about how the new building is structured to handle those court-ordered patients?
98% of our patients right now are court-ordered. So you have to have committed a crime to come in. Sometimes the charges are dropped and then they're civilly committed, but they're still a little too dangerous to release. So the new building, when you come in, there's one way in and one way out for the patients, and one way in and one way out for the staff. This way we can really do our risk assessments and give them what the category that they need to be in. So we have fences that are 16-foot fences for security. We want to make sure that when we take patients outside, the community is safe. And one of our main objectives is community safety. And we want to make sure the community is safe, the hospital staff is safe. The nurses station, when you stand at the nurses station, you can see directly down the hallway of each and every hall.
Great. And last question, I know that we're moving the patients from Goonsburg over to the new building. Are there any plans for Goonsburg?
We would like to have a psychiatric secure substance abuse center. About over 80% of our patients right now have a substance abuse issue, and we can definitely better serve them if they're in their own environment and had other people around that are struggling with the same illnesses they have.
So do you hope to be able to take non-forensic patients off, like homeless that may have mental illness, off the street if we can open up Goonsburg?
Yeah, right now at Goonsburg we can separate it into 4 different units, and we can have for homeless, we can have for substance abuse, we can have for people that are just struggling and looking for other alternatives. With our unique campus, patients can be admitted here and we can transfer them over to Goonsburg and not have to worry about getting court orders for substance abuse, because many of our folks, as I said, over 80%, either come in with paraphernalia or admit to using, but we have no place to really treat them.
Okay, great. That sounds like a really great missing puzzle piece to our mental health puzzle that we're dealing with right now. So Ron, tell us about this new facility or new project that we're working on here.
Oh yeah, the new project, Aluhu, is really nice. We started out here a few months back with just a clear field, and it was just grass and dirt and all of that. So this facility is good for quarantining as well as isolation. So it's keeping the community safe as we live in this COVID environment.
That's great. Let's go in and take a look.
Okay.
All right, so Dana, tell us about this facility.
The type of clients that we have at our facility include COVID positive and COVID negative clients. In addition, we are specifically focused on behavioral health clients. So we're able to take individuals who are diagnosed with like schizophrenia, schizoaffective, and help them to not only quarantine, but also isolate. So isolating is for the COVID positive clients, and then quarantining is for our clients who are requiring a little bit of assistance with links to services. And some of those services include like getting them housing, getting them a psychiatrist, like linked to a psychiatrist, getting them support from within the community to like help them to maintain stability and gain independence within the community. With every single room, we have a twin-size bed inside there, a television, phone, Wi-Fi access. They have like yoga mats and stuff. So we try to make the rooms as comfortable as possible for our clients during their stay.
All right, would you mind if we take a look inside a couple of these rooms? So this is one of the new units. Quick shout out to Alexander and Baldwin for donating some money to help furnish these units. Actually, the money is going to be going to furnish the new units. There are going to be a number of new containers like this put in both here and at another location to provide not only isolation and quarantine units, but also transitional housing for state hospital patients moving out of the hospital before they move back into our communities, just to kind of help them with that transition.
With their stay here, we do like to make it as comfortable as possible, and we do also provide 3 hot meals a day throughout their stay here, as well as snacks and drinks in between and stuff. So we want to make their stay as comfortable as possible, and that's why we set the room up the way we did.
Yep, so this is the Kaneohe Joint Outreach Center. It's right next to the Kaneohe Police Station. And myself, Representative Kitagawa, and Senator Keoko Lole put this together about a year and a half ago, pre-COVID, to try to address the homeless situation in Kaneohe and along the windward side. So what this facility does is it provides medical services, Medicaid sign-up services, and other social services to homeless on the street, or anyone in the community too, who wants to receive it here free of cost.
And how is this facility funded?
So the facility actually, me, Representative Kitagawa, and Senator Keoko Lole went out and got funding from private organizations, private foundations, businesses for the 3-year pilot program. This facility is a state facility though, so we also had to more or less commandeer it for the 3 years. And it's a true state business collaboration to try to make a big positive impact on our homeless population. We're also partnering with H4, who is running the Kaneohe Joint Outreach Center itself.
And since the pandemic, what has the community seen with the use of services here at this Joint Outreach Center?
So before the pandemic, we had patients walking in for medical services and for social services. Once the pandemic hit, we really saw a drop-off in people walking in, so the Joint Outreach Center shifted its focus. Now the nurses and doctors will actually go more out to the community, to where the homeless are, to administer both medical and social services, and to try to bring them back here if they can. Right across the street, we've got the food stamp welfare program too. One of the big things too that I really love is it provides a permanent mailing address for homeless. I'm really hoping that we see a real positive change in the homeless population on the windward side due to the Joint Outreach Center.
So we're downstairs from the Joint Outreach Center. Can you explain what this space is?
Yeah, so this space is currently being used as kind of a multi-purpose meeting space, but we're hoping to use it for community court so that we can have, again, we're trying to centralize all of the services in one location. Community court is a really great program. It's mostly meant to deal with low-level, non-violent offenses, get rid of bench warrants, get rid of a ticket for someone sleeping in their car, and it gives the judge a lot of latitude. So instead of imposing a fine, they can convert that into community service hours worked. So far, I believe they've cleared about 4,000 violations, mostly from, again, low-level homeless violations of sleeping in the park or whatnot. So we're hoping that the judge can zoom in over here. We're going to be renovating this place to make it more ADA accessible, and we can start holding court proceedings here so that when the homeless come in, they can get their charges cleared or converted to community service hours, and then they can walk right upstairs to the Joint Outreach Center or to the Social Services Office and kind of get everything done all at once.
Well, thank you again for your leadership on this. I think we'll be talking to CJ Rechtenwald about the progress of the community court, and we'll definitely follow up with him on this prospect as well. Thanks, Representative.
Thanks.
So seeing the continuum of services in Kaneohe, from the state hospital to the future transitional beds to the Joint Outreach Center and a possible community outreach court, the judiciary and the courts really sit at the center of all of these huge challenges that we're facing with regards to mental health, homelessness in the community.